It was a tense moment for the family of baby John Bukenya as doctors carried out a screening test to find out whether he had a heart complication. The results turned out positive. Bukenya is just 1.5 months. The doctors found a defect in one of his valves which changed the way blood flows through his heart and lungs.
And that valve is supposed to lead blood to the right ventricle that later leads blood to the pulmonary, to the lungs, where the body picks oxygen. So since that valve did not form, baby is blue.
Then blood coming back on the left side of the heart, which is clean, will be, part of it will now cross to the right ventricle. And from the right ventricle, it will be pushed back to the lungs. And remember, there is blood which came to the right side, which was unclean, also being pushed back to the lungs. So all that will increase the amount of blood going to the lungs. And the lungs cannot handle this large volume, so it floods.
This toddler's condition requires sophisticated equipment which isn't available in Uganda. Doctors have recommended that he be flown abroad for a heart surgery which costs over 50 million shillings.
And so their financial status is not so good. You know that they're going to be in and out of hospital. Anyone who sees this child, say, up country, a pediatrician also will keep saying, go back to Mulago. And yet you don't have immediate answers for this child.
The doctors say Bukenya's heart defect is a rare one that cannot be treated in the country. The Uganda Heart Institute in Mulago has been conducting open heart surgeries since 1998. Just recently, its medical practitioners have done corrective surgeries on blocked vessels without dissecting patients.
It's just about like 5%. Most of the other conditions, we have local capacity to handle them. And even our capacity to handle even the complex ones is progressively being built.
I met Charity Amara at the ward recovering from her operation. She had a hole in one of the upper chambers of her heart. Amara is one of those lucky patients whose surgery was funded by well wishers.
Like when she lifts a jerrycan of water, be it 5 or 10, she could complain, "Mommy, I'm so tired." Then washing was also another problem. Once you tell her to wash, she wanted to kneel or squat in order. She couldn't bend and wash.
The Uganda Heart Institute is capable of treating more than 1,000 patients a year, but it only treats about 100. This is because of the high cost of the super specialized items that they have to buy abroad. On average, a surgery costs about 10 million shillings.
Even when you look at our national medical stores, the things they're able to supply us will rotate about those common goods. Ours is not a common service. Ours is a super specialized service.
Now the Rotary Club of Kampala, Sese Island, is organizing a go-kart race on the 20th of this month to raise 200 million for conducting such surgeries.
And we think that if, as a club, we managed to put together at least 200 million shillings annually, we would have done our part in supporting the Institute and lending a hand of support towards the heart patients who otherwise would not have been operated on.
The acquisition of equipment that can detect such complications has greatly helped in getting those with the means to get the treatment early. Expectant mothers are advised to tell the doctors or health workers of their state to avoid any prescription of dangerous drugs or being exposed to radiations, because these are some of the risk factors that expose the unborn baby to the heart disease. Among the 20 children screened every day for heart disease, half of them are confirmed to have defects, with many being congenital. Irene Namyalo, NTV.